My name is Ellis. I'm an orthopedic spine surgeon at Coryell Health in Gatesville, Texas. I have been living in Central Texas for the last almost 10 years. A couple of years ago, I had the really unique opportunity to move my practice to Coryell Health and jumped on it, and has been one of the best decisions I've ever made. My practice is pretty diverse from an orthopedic perspective. I do elective joint replacements from minimally invasive muscle sparing total hip replacements to robot assisted total knees and revisions of both. I also do spine surgery. We have a really amazing ability to do some intricate, modern, cutting edge spine stuff here at Coryell Health. Practicing medicine has always been complicated. Certainly everyone, I think, would understand that, but as years have gone by, the things that make medicine more complicated have just exponentially grown. So most doctors are left with a situation where they're trying to find a way to be a doctor and do it with the least amount of hassles and things that kind of get in between you and your patients. Some of that will never go away no matter where you work, but when I had a chance to come to Gatesville and meet with the leadership at the hospital here, from the CEO on down to some of the practicing physicians, it was very clear that this was just a wonderful opportunity to practice medicine first and worry about kind of the business side of medicine after that. I'm a doctor first, my patients are my patients. We interact the way I hope someone would interact with my own loved ones if they needed to see a doctor. And then on top of that, we might be a small critical access rural hospital in a smaller town, but we don't behave like that. We have some of the most amazing cutting edge technology in our little facility here. We have brand new operating rooms and just absolutely gorgeous brand new inpatient hospital rooms for our patients. If you come have a surgery here, if you're having your knee replaced, for instance, it's very likely that you're going to be getting it done with a robot that's specifically tailored to your unique anatomy. It helps us as the surgeons really dial in the reconstruction to a way that's specifically fitted and hopefully optimized and ideal for you. Not just the same way it gets done for every person, like a cookie cutter type procedure. We also have, I do a fair amount of microscopic spine surgery here. Very intricate, minimally invasive, all of the quote unquote buzzwords, but it's the ability for us to really tailor your treatment to your specific needs and in a way that's not limited because, oh hey, I live in a small town. Long before I moved here, I practiced in a way that where you live should not have an effect or as little effect as possible on the care that you receive. Your life as a patient is no less important than someone who lives in a fancy part of, a big city. I've said it here several times here before that I feel like I practice big city medicine but with a small town feel. And I live that every day. It's an absolute pleasure. Getting in to see myself or our colleagues here is super easy for everybody. We're reachable by phone. We advertise, we have a very amazing social media presence, but the nice thing about that is, even though the world's gotten more complicated from an electronic perspective, we are still just a nice human touch. You call, you're going to speak to one of my assistants who works solely with me, knows my schedule, and we're able to get you kind of through that process as painlessly as possible. I think that should never be a barrier to come and seeing us here. Spine surgery is a big, giant basket. We've all got a loved one in our family who's had a spine surgery. We all know someone who's got a, quote, bad back. Every single person you know is kind of unique and really hard to classify in one simple thing. Spinal problems are no different. Typically people come to see us because their back hurts or their neck hurts or they have pain in their arms and legs. It starts in their neck and back. And these are very normal. It's a normal way for humans to experience this stuff. But the not normal thing is how you approach it. We're very, very committed to the idea of trying to find out what is uniquely causing your problem, and so that we can address it in a way that's the least aggressive way possible. And so with our practice, we try to, everything we can, avoid surgical intervention. When we talk about total knee replacements, a doctor I trained under, whom I think highly of, and he had a lot of experience, and he said all the time, if your knees don't hurt, you're a liar. We see this every day. People have knee pain, that's the way we experience the world. Doesn't mean you need a knee replacement, but if you're getting close to that point, there's a lot of things that we'll do to intervene. There's some at non-invasive therapies. There's some bracing, some medications, some physical therapy, some motion therapies. There's even some injections and things that we can do to try to minimize your need for having to go all the way to some version of a joint replacement. Once you cross that chasm and you think, man, I just can't live like this, the pain's too bad, I understand what the doctors explained to me. The nice thing is we have some other options there as well. We have partial knee replacements. We don't have to replace all of your anatomy, just the parts that are kind of worn out. Can buy you some time. And ultimately, we do a fair amount of knee replacements here, and it's a really wonderful procedure both for the surgeon, because quite frankly it's fun to do, but it's also fun because in the clinic, when you come see me in your post-op visits, you're going to be thrilled. These are the patients that usually hug me, talk about how great their life is and how different it is. A patient today talked about going on a hike with his 2 daughters, climbing up several steep inclines that he couldn't have done 2 months ago. And here he is now living a completely or nearly completely liberated life. It's not a guarantee, I'm not here to mislead anyone, but boy, it sure is more frequently the outcome we get when we interface with patients that need their knees and the hips replaced. Coryell Health is a very unique place, at least as far as my experience, and I've been in private practice for almost 15 years. Granted, every hospital and every business has got to keep their doors open, but I've worked at several large, super well-respected, incredible facilities, and almost invariably there's conversations about why we can't do the things that we know we need to do because it costs too much, or the hospital found a way to get a cheaper version, and we're forced as doctors to try to somehow sell this to patients like, oh, this is just as good, don't worry. I'm not to say that we're immune to those concerns here completely, but the hospitals run in just such an amazing manner from the leadership on down. And some of the mechanics of the way that they interact because of the critical access nature of the hospital, meaning everyone knows that we need to keep this hospital and ones like it open so that people that live in these communities don't all have to go to some big massive metropolis to get what's sometimes routine care. Because of that, it's allowed us to practice here. Myself personally, I could testify, I practice in a way that I don't really spend a lot of time worrying well, I really think the patient needs this, but there's no way the hospital would do that because it costs too much. Maybe there's a cheaper version made somewhere else. The first priority almost every interaction I've had here to date, in the more than 2 years I've worked here, has been put the patient first. We'll figure that stuff out later. And I would testify to that being the case universally here. My practice is a primarily elective-based orthopedic practice. It focuses on reconstruction of the spine, the hips, knees, and other joints like the shoulder. Medicine is constantly changing and improving, and one thing that is indisputable is that the direction of at least orthopedic world is going to go to increased data, including robot-assisted surgery. Myself and the other colleagues here, we've been trained in the special techniques for applying this modern technology to your needs specifically. I had the pleasure of training some of the foremost spine surgeons in the world. Doing that, I learned some of the really amazing cutting-edge techniques, and it's been really amazing to be able to bring that to Gatesville here at Coryell Health and apply those same minimally invasive but truly maximally corrective techniques to my patients. Currently, I see patients in the clinic here in Gatesville at Coryell Health. We also have a clinic in Waco, Texas. We also go to Fairfield, Copperas Cove, Glen Rose, and Comanche, Texas. I'm Dr. Lance Ellis, orthopedic surgeon at Coryell Health. Please come and see us. We'd love the opportunity to show you what world-class healthcare really looks like.